Alright, so for the next metabolic bone disease which we'll be looking at is what is known as what? Hypophosphatasia. Of course, looking at this hypophosphatasia, you can get to just see that okay, it has to do with there's low phosphate levels in the body. Alright, low phosphate levels in the body. Alright, so we're just trying to establish the link. If there's low phosphate levels in the body, how can that it be able to actually affect the bone and make you have like brittle bones? Alright, so hypophosphatasia, we said that it is a rare like inherited metabolic bone disease. Alright, so this one is not really due to food stuff, right? It's usually inherited. So you have a mutations in an enzyme known as ALPL gene. So this enzyme encodes that's the gene encodes an enzyme known as what? The tissue-nonspecific alkaline phosphatase. So this enzyme is actually essential for proper bone and tooth mineralization. Alright, so if you have a defect in the gene, you have what? Defect in levels of enzymes, you have defect in bone and tooth mineralization. But pathophysiology is what? Deficient tissue-nonspecific alkaline phosphatase activity. So this usually leads to what? Accumulation of inorganic what? Pyrophosphate. That's a natural inhibitor of bone mineralization. Alright, so this results in the patient having very soft, poorly mineralized bones. Alright, so it can actually result into osteomalacia or rickets, and premature tooth loss. So you have problems in the tooth too. You can see how it actually comes up. So clinical forms, you can have the perinatal. This one is found against skeletal hypomineralization. Okay, usually at or before birth. Infantile, this one is within 6 months, usually affect respiratory tissues. The person has bones that are prone to fractures and they don't really grow well, so failure to thrive is there. Right, so it can also occur in the childhood. So delayed walking, bone pains, fractures, premature loss of baby teeth. Adults, stress fractures, chronic pain, dental issues. Then odontohypophosphatasia, that one is affecting only the teeth though, with early loss of deciduous teeth but no really bone symptoms, right? The perinatal benign is a mild skeletal abnormalities that may improve postnatally. The pseudo hypophosphatasia is rare. Okay, you have clinical features of hypophosphatasia, but there's actually normal alkaline phosphatase. So whenever I hear pseudo, of course, it's something that is almost like the main thing. You understand? So I think this is just so diagnosis is where you measure alkaline phosphatate levels. They are usually low, elevated PPIs, okay, vitamin B6 and PEA in blood and urine. Then you also do genetic testing because you want to actually spot out that there's mutations in this ALPL gene. Radiographic features, that's if you do all those x-rays and stuff, you see that the bone is what? Hypomineralized. Alright, there's fractures and skeletal deformities. So treatment is what? Enzyme replacement therapy with what? As phosphatase alpha, that's the strength. Right, supportive care including pain management, physical therapy, dental care. Then you can supplement to replacing calcium, replace vitamin D and all of that. Okay.